Hello and welcome to the program today. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us. Our guest in studio is David Fetterolf. He's the president of Stratus Video, and they're addressing a need for hospitals across this nation to provide interpreter services for non-English speaking patients and doctors. Welcome to Health Professional Radio, to this health supplier segment, David Fetterolf.
Thank you very much, Neal.
Now, Stratus Video, when did you become the president, or is this a company that you founded?
No, this was a company that I was brought in to run, and I came to Stratus about 4 years ago, November 2012. And at that point in time, it was a very, very small company with low revenue and less than 10 employees. So it was really a startup when I joined at the end of 2012.
Now you've created quite a bit of revenue growth over those last 4 years. Is there one endeavor in particular that seems to have catapulted you into this success?
I would say, what we did is we came out with a video remote interpreting product that was very different from every other product on the market. And you have to understand a little bit about the market to understand sort of how and why we grew so quickly. So the interpreting market in the U.S. in healthcare is about a $2 billion market segment. And traditionally, interpreting in hospitals and in medical practices was done either with an in-person interpreter, someone that stood next to the physician and the patient and interpreted to the physician, or it was done over the phone, right, where the patient would hold a headset, the physician would hold a headset, and you would call an interpreter on the phone. Over the phone interpreting, you can get interpreted very quickly, within 30 seconds to 60 seconds, and it's pretty inexpensive. An in-person interpreter is very expensive, but it's a much better interpreting session. So what we did is we came out with an application that ran on an iPad, an Android device, or any PC or Mac, and it let the physician, with one touch of a button, they could touch Arabic, and within 30 seconds, we could bring an Arabic certified healthcare interpreter onto the screen live, and that interpreter would be looking at the patient and interpreting for the doctor.
That's amazing.
And what this did for the market, what it did for the market is that type of solution is almost as good as an in-person interpreting session, but it's at the same cost structure, right, and speed of answer as an over-the-phone interpreting session. So we were able to come into the market with a product that really nobody else had, right? And through some, very aggressive sales and a lot of hard work, we've been able to capture and convert a lot of the market from both in-person interpreting and over-the-phone interpreting over to video. And we are currently the market leader in video interpreting. And that's what initially catapulted our growth, was that unique product offering. And then since then, in this past year, we acquired an over-the-phone interpreting company, so now we provide over-the-phone services as well that we can sell back into that video client base. And we also came out with a product for in-person interpreting. It's an Uber-like application where providers can request an in-person interpreter, and just like Uber, the car company, it pings interpreters on their iPhone, and they can see them moving on the map towards the hospital or the practice. So now we're able to grow in all market segments now that we've captured and are dominating the video market segment. So that's going to enable us to continue this growth trajectory.
As far as your interpreting staff, are you getting interpreters from the United States, or is this a worldwide network?
It's a combination. So all of our world languages, all of our interpreters, with the exception of Spanish, are all located in the United States. They're salaried interpreters, and they're really throughout the entire country. Spanish, we have lots of interpreters also in the United States in Spanish, but we also have a couple hundred interpreters in Costa Rica that do Spanish to English interpreting. All of the interpreters are medically qualified and or certified to do healthcare interpreting.
Now, is your platform supported? Is it internet-based? I know you've developed this app. How? I guess my question is, how seamless is the transmission? Are we talking about lag times and things that we encounter and we determine them to be problematic when we're doing telehealth via the internet?
Yeah, no, that's a great question. So no, this platform is it's all web based. It runs over the internet. It's the video is very, very crisp. It was originally developed to serve the deaf and hard of hearing community for sign language. And with sign language, you need very, very good video. So that was the roots of the company, right? And then we took that product and moved into language interpreting. So, and that's one of the reasons, really to this day, people have not been able to copy us and come out with a product as good as ours, because it's a very difficult proposition to run a video session over the Wi-Fi in the hospital out into the internet and then automatically switch it to the right interpreter. And you mentioned telehealth, because we believe that is going to be a huge growth opportunity for us in this coming year, basically using the exact same technology that we have to deliver video interpreters. We're going to use that technology basically to connect physicians on consults, to manage and manage really telehealth communications, all via video, all with the same network that we've honed and made work on the video interpreting side. So that's a very large opportunity for us as we look forward.
Now, David, talk a bit about the importance or the lack of importance about your interpreters being well-versed or versed at all in medical terminology, or is it simply a matter of being able to repeat what the English-speaking physician is saying to the non-English-speaking patient?
Oh, no, it's incredibly important to be well-versed in medical terminology and also to be trained as an interpreter, all right? Just being bilingual, all right, does not make you an interpreter. Interpreting is absolutely a skill that you need to be trained on, and there are certifications in the United States for languages where you can get certified in medical interpreting, right? And then, there are lots and lots of languages. I think there are 8 or 9 certifications in 8 or 9 languages. And then, we have classes where we will qualify people if there's no national certification available. But it is absolutely critical when you really think about the end product that we offer. The product is actually interpreting. It's not the technology. The technology is what delivers the product, and the technology is what has set us apart and enabled us to grow. But when all is said and done, the interpreting is actually the product. So you need very highly skilled interpreters, and that's really what makes Stratus great and special, is our network and our employees that are interpreters for us.
Now, with such a high importance laid upon training, how much of that responsibility falls on Stratus Video employees or contractors, and how much falls on you as the provider? We have we've put together training sessions for our interpreters. So when we go recruit interpreters, we try to recruit interpreters that are already qualified and have certifications. But even if they do, we still put them through a test to make sure that they're good. And then we have online courses that they take that we have developed. And we're putting something together called Stratus University, so that we're able to train and teach interpreters on both how to interpret as well as the specific medical terminology. So we do take responsibility for it, and we do a lot of work in that area. Now, when it comes to training, how much training does the patient have in understanding this possibly absolutely new to them technology? I know you're training the physicians in how it works as well as your interpreters, but what about the patient who may be absolutely new to this type of technology?
Yeah, it's really interesting because the patients are used to over the phone interpreting, and some of them may be used to in-person interpreting. And the physicians are too. So the first time they see video interpreting, they're usually shocked and surprised and very happy because it is a world of difference when you compare it to an over-the-phone interpreting session. And so it's a very, very positive experience. There's really no training that is needed, by either the physician or the patient. With our application, you literally touch one button, whichever language you want, and then the session begins and an interpreter comes up. And then it's just the interpreter starts the session out with a little, explaining, who they are and what they're going to do, and then that's it, and the session begins. All right, but it's usually a very, very positive experience, mainly because the patient was used to an over-the-phone interpreting session, which is much more difficult when you're not seeing the patient.
Now, in wrapping up, David, where can our listeners go and get much more information about Stratus Video and this brand new method of interpreting?
They can go to www.stratusvideo.com.
Great, thanks. It's been a pleasure having you here with us today, David.
Thank you very much. I really appreciate it.
You've been listening to Health Professional Radio, this health supplier segment of the show. I'm your host, Neal Howard, in studio with David Fetterolf, president of Stratus Video, addressing a major need for hospitals by providing interpreter services to non-English speaking patients and doctors. Transcripts of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.